to the Greater Winterhaven Chamber of Commerce Ask the Doctor series. This series is done in partnership with Baycare's Winterhaven Hospital to give you, the community, an opportunity to get to know our local physicians, as well as the many services that Winterhaven Hospital provides to keep our community healthy and thriving. On today's episode, we speak to Dr. Evans, who is the Director of Cardiothoracic Surgery at the Bostick Heart Center. Dr. Evans tells us a little bit about why he chose Winterhaven, the family culture growing at Winterhaven Hospital, and the many services that are available at the Bostick Heart Center. Well, Dr. Evans, thank you so much for being on the show today.
Yeah, my pleasure.
So usually how we start these interviews is to kind of get to know you a little bit more. So if you wouldn't mind just telling our listeners a little bit about yourself, your educational background, and where you came from.
Okay, so I'm originally from Indiana. Family forever was from Indiana. Dad was actually the state school superintendent and ran for governor. So a lot of roots in Indiana, but would come to the South. And as my kids were growing up, we would head back to Indiana, and they would always say, "Why are you depressed?" And I said, "Well, as soon as you get into college, we're moving to a palm tree state." So 16 years ago, the hospital was wanting to start a cardiac surgery program, and it was a perfect fit because I was bound and determined and ready to move south. It was a very kind of Midwestern feel, to the area, which was perfect for me. And came down here and I fell in love with the people, fell in love with the hospital, and I'm excited to be able to breathe Florida air every day, both in the winter.
I'm sure it's a lot different from Indiana.
Yeah. So that's me.
Yeah. So did you seek out this position with Baycare, or did you kind of
find it? I used to give a lot of talks around the country, actually around the world, a lot of presentations, and it was pretty well known that, I love to play golf, and I love to play golf year round. And so I would get all these phone calls from headhunters that had positions open in the South. And I was actually playing in a golf tournament in Orlando, and they said, "Hey, there's a place called Winterhaven, you should stop by." And it was kind of all, uphill from there.
Sounds like fate just wanted you to be here.
That's been great.
So what would you say, being in Indiana and having your experience there and then coming here, are there any glaring differences from Indiana to Winterhaven as it pertains to your expertise as far as being a doctor and the medical field?
Yeah, so one of the nice things is I had practiced there long enough to know, and in big kind of group settings, large city settings, because I was from Indianapolis. There's very few opportunities that someone has to sort of take a blank slate and create what they really know is the best way, the most efficient, the most effective way, without trying to change a system, to actually create a system. And that's what the beautiful thing about this program is we were able to create the ORs we needed, the ICUs we needed, the recovery areas, the systems. And so that the biggest difference was being able to take the things I'd learned for 15 or 20 years, and then to apply them in their best form. It's like having a whiteboard that you can then create the perfect result, and that's literally what we got here. And I say that, and it's not it's bragging about the system, which is easy to brag about, because the system here, so there's something that's called the Society of Thoracic Surgeons National Database. It's the largest medical database in the world. And they basically give you a grade card every quarter, and in thousands of different areas, and thousands of different data points. And we've had a 3-star rating since the inception, since the very first 3-month period. And so we know that the results aren't just what people say and what we think, but it's actually backed up, but with hardcore statistics. So it really makes it nice to be able to have that to present to patients so that it's not just that we're confident, but then they can be confident in, the product that we have to give them.
Absolutely.
And
And did you
serve
say
them.
you were there at the start of the Bostick Center?
Yes. Yeah.
So what
I was
would you
here, and then
say?
David, my partner, joined me about 9 months later.
Okay.
And one of the other beautiful things about that is, we're very simpatico. Two Davids, it's pretty easy.
Right.
And from the start, we agreed together to do things exactly the same way, which just creates all kinds of efficiencies, and it's worked out wonderfully.
So what would you say, seeing it from the beginning to now, is there something that you're particularly proud of when it comes to the Bostick Center?
Yeah, well, so certainly the infrastructure has been updated, and so I always like to say that you could have a great pizza, and you could have it, in the back alley, and you could have that same great pizza looking over the Pacific Ocean, and somehow it just tastes better
Yeah,
looking
that's
over
a
the
good point.
Pacific Ocean. So I think that, people obviously are pleased with all the people that the culture that they meet when they come here, but it's not kind of nice to have a nice, a nice environment to deliver that culture in. So,
Absolutely. So what are some of the common issues or symptoms that would bring patients to see you at the Bostick Center?
yeah, so and the best really, I think, comparison is the oral surgeon versus the dentist. So everybody sees their dentist.
Mhm.
And if a problem is determined or diagnosed or felt like there might be a problem, then they're sent to the oral surgeon. So that's really people just don't come and knock on our door and say, hey, I want heart surgery.
Right,
So they're going to be
right.
seen by their doctors or the emergency room. They're going to have tests that typically will have been seen by a cardiologist and been tested through that before they actually come to need cardiac surgery. And the kind of things that basically we treat, the most common thing is coronary artery disease or atherosclerosis, people that have heart attacks, people that have angina. And again, they will have been determined to have had blockages of the arteries in their heart by their cardiologists through various studies. And then they'll come see us. And we actually have a team of not just my partner and myself as surgeons, but invasive cardiologists, non-invasive cardiologists, electrophysiologists, and a group of people that we will discuss patients with to determine, what is the best modality to treat someone with. Because sometimes if you have a hammer, everybody looks like a nail. But if you have a hammer and a screwdriver, you can determine really which is the best thing to treat them with. And they may need both a screw and a nail,
Right.
or they just may need one or the other.
Right. So what are some ways that the people watching this could maybe prioritize their heart health so that maybe they can avoid coming to see you one day?
Right.
Always pursuing that whole health, and trying to keep your heart healthy so that you can avoid having to get those serious surgeries.
Sure. Well, I always tell everybody that we know what the right thing to do is. Myself included, oftentimes we just don't do it. So it's exercise, try to relieve stress, um, not smoking, diet, more fiber, less fat. More white meats, less red meats. Again, most of us know what the right things are, and it's a lot easier said than done because pizza just tastes great,
It sure
and
does.
you can still have pizza, just maybe not quite as much as you would want to have pizza. And that's
Right.
kind of really the rule of thumb for most things like that.
Yeah.
So that the things you can do are infinite. The things that people probably will do, it's really probably not that hard. One of the best things is as you get older, to see your family doctors and to make sure that your blood pressure is controlled, make sure you don't have diabetes, make sure your weight is controlled. And quite frankly, one of the things that, then I say newest things, even though it's not new at all, but when you're my age, it seems new, but it's statins, it's cholesterol lowering medication. And most doctors, once you get to be a certain age, are going to probably start talking to you about using statins anyway. But it's something to keep your eye on. It's one of those things that if your doctor hadn't mentioned it, would be certainly an easy thing to ask them if you should be on it or not.
Mhm. So there's a little bit of an element of trying to get that preventative care, and then also just trying to live a healthy lifestyle, it sounds like.
Yes, and unfortunately, there is a large component of family history. So genetics does play a large part of it. So you could do all those things, and do all those things right, and still end up with coronary disease. Now,
Right.
the other thing that we treat is we do treat quite a bit of valvular heart disease. And again, there's not a lot you can do about valvular hearts. There's some of it's congenital. Much of it is from youth, from even though you never were diagnosed with it, but you probably had rheumatic fever. There are sometimes the heart just gets weak and the valves break down. But it is something that we do a lot of valve repair and then valve replacement. And one of the nice things that we have been able to develop here is a robust, what we call structural heart program, which is kind of the newest technology, particularly in valve surgery, but also in rhythm surgery and whatnot, where, several years ago, if you needed a new aortic valve because it was narrowed or stenotic, you would need open heart surgery. And what we can do now is a percutaneous method, which in other words, through an artery in the groin, in the wrist, in the neck, to place a valve that expands in the position of the valve. And it's essentially a next day home, and people are actually starting to go home same day surgery instead
Oh,
of an open
wow.
chest on heart lung machine type of an operation. So things continue to evolve, and that's really probably one of the biggest new evolutions and that we're able to offer here in Winterhaven.
Yeah, absolutely. Being able to go home the same day of a surgery
A
is,
valve operation, that's not
yeah,
bad.
yeah, that's incredible. So how many surgery options do you guys provide? Is it just kind of the valve and the heart, or are there any other surgeries
Yeah,
that?
so there is, surgery options. There's thousands of different operations. We do rhythm surgery, so pacemakers, defibrillators, and but we also do a fair amount of lung surgery, so lung cancers, which is really one of the more feel good operations, because you get lung cancer early, that can be diagnosed early, and a resection is basically curative without chemo, without radiation. It's a 2 or 3 day stay in the hospital and a couple months recovery, but then that's basically can be considered a cure in many situations when it's diagnosed early. So so you talk about the different things. Open heart surgery, there's, again, we talked about structural heart type percutaneous surgery and lung surgery, and that hits pretty much most of what we do.
Right. Well, is there anything else that you would want to share, Dr. Evans, with maybe somebody who's watching about maybe coming to see you, or preventative care, or any other tips that you have?
Yeah, well, so come and see us, but I hope you don't need us. I think one of the nice things, and that really the one of the most exciting things, is the culture that we've been able to create here at the hospital of a real sort of family. Patients are family, the team's family, the nurses are family, and all the other hospitals that I've really practiced at over 40 years. There's really have not experienced that anywhere else, and that's makes it pretty fun to come to work.
Well, that's great. It's amazing for you guys in the workplace, and then for people like me and people who may be watching this who have to come to the
Yeah.
hospital, even though you don't really want to come to the
May have to,
hospital.
but may benefit from it.
Yeah, it's a nice experience, as much as it can be, to be surrounded by people who are going to take care of you and do it with excellence. So that's very important and encouraging to hear that. So Well, Dr. Evans, thank you so much for being on the
You
show
bet.
today.
Yeah, no problem.